So red flags and female fertility. It's estimated that there are about 70% of women who are going through subfertility that have issues. And we just don't talk about it enough. Like so many things with female health, it's really not focused on. But it's very, very important for you to know what is normal and what is not quite normal and recognise the signs and symptoms. You might have already been diagnosed with something, you might be waiting for tests, or you maybe even haven't been to your doctor about this yet, but these are some of the things that you should be aware of. So firstly, your periods. Your periods are a really strong indicator of if things aren't as it should be. An average period length is between 24 and 36 days. So if your period is less than 24 days or more than 36 days each month, this could indicate that there are issues with your cycle and with your overall fertility health. Another issue potentially with your periods is if there is a 7-day gap. So some people, for example, will have a 28-day period one month, a 32-day period the next month, and that's all completely normal. But if you're finding that maybe you have a 25-day cycle one month, a 35-day cycle the next month, and then a 42-day cycle the month after that, that could also signal that things aren't quite right. So would need kind of looking into and addressing. Painful periods. I cannot say this enough, but really painful periods are not normal. And I think as women, we've come to accept pain, and everybody kind of tells us, oh, it's fine, you know, you've got a heavy painful period, you know, kind of get on with it and don't worry about it. And even clients have told me that doctors have said that to them. But if you think about pain in the rest of your body, if you have pain, it's your body screaming at you, something's not right. If you have a headache, if you have like abdominal pain, these are things, your body's way of saying, help me, something isn't doing what it should be. So really, periods shouldn't be any different from that, and we need to kind of break away from the norm. Painful periods that stop you going from work, that mean you bail on friends because it's just too uncomfortable to leave the house. You need really strong painkillers, and I don't mean like paracetamol that you get over the counter. That level of pain needs investigating, because if it's life impacting, you shouldn't be having to live with that. Heavy periods. So it's estimated that the average period is approximately 80 mils per from when you start your period to when you finish your period. But actually measuring your menstrual cycle is quite difficult unless you've got a menstrual cup, in which case you can look at the measurements, note it down, and then total it throughout the period. But I think an easier way to know if your period flow is normal or not is how quickly you soak through pads or tampons. If you're using a super thick pad or you're using a super tampon and you're soaking through that within an hour and a half to 2 hours, that's definitely something to be concerned about, because that's a very heavy loss. Also, if you are feeling faint when you have your period because your blood loss is so heavy, and if you're passing big clots, that would indicate that there are issues as well. Now, some people do pass clots because there are pieces of tissue in your endometrial lining. So the lining that's in your uterus does have some tissue, so you might find there's some small, like kind of dark looking clots. But anything I would say that is bigger than 1 centimetre or 2 centimetres is more than it should be. And then we can have the opposite side of things, where you actually have no periods, or your bleeding is maybe 1 or 2 days. There's hardly anything, you barely need to wear a tampon, you barely need a pad, or you don't have periods at all. And this can be linked to hormonal deficiencies. Sometimes it can be to do with a lack of estrogen reserves. So you're not quite having periods, or you're not ovulating at all. And that's called anovulation, and would definitely need investigating, because if you're not having periods, you're not ovulating. So therefore pregnancy is not achievable. So another thing I see quite frequently is doctors putting people on the hormonal contraceptive to treat, and I say treat, these conditions. It doesn't treat the conditions, it just masks it. So let's say, for example, you're 18 years old, you go and see your GP because your periods are really heavy, really painful. They prescribe you the contraceptive pill. You take that for 10 years, and then by the time you get to your late 20s, early 30s, you want to try and have a baby. You come off the pill and you start having really heavy, really painful periods again. And that's because the issue hasn't gone away, it's just been masked with the contraceptive pill. So I say it's a bit like wrapping a bandage around a burst pipe. Like, it's going to contain it for a while, but as soon as you rip that bandage off, water's going to go everywhere. So if you're in the situation where you've had this form of treatment for an underlying condition, you may want to push for investigation sooner rather than later. There's no point in waiting 1 to 2 years of trying to conceive before you have further investigations when you know that there's already potentially underlying issues. Another sign that there could be an issue with a hormonal imbalance, and you may have more testosterone than you need, is hair growth. And we call it male patterned hair growth. So it could be on your face, on your chest, on your back. You might have patches of hair that are really, really thin, or kind of baldness. That's something that's quite common with increased testosterone in females. You might have really oily skin or have quite bad acne, and that can indicate that there is a bit of a hormonal imbalance there. Hot flashes and vaginal dryness can be linked to signs of premenopause as well. So if you have a family history of people going through the menopause early, if your mum went through the menopause in her 30s, then it could be something that is linked to you. So if you are having hot flashes and you're noticing vaginal dryness, maybe you're not getting as much discharge as you had previously, that can indicate that you could potentially be going through the menopause early, so would need addressing. I know we've talked about a lot of signs and symptoms already, but just to highlight, there are some other things that can indicate there is hormonal imbalances. And these things include excessive fatigue, mood disorders, depression, low libido, and sleep disturbances as well. And this is to do with the pituitary gland and the hypothalamus. These are glands that control so many things in our bodies. So they don't just control our hormones, but they control our temperature, they control sleep, they control our mood, they control like our metabolism. So there's so many things that are linked to the pituitary gland and the hypothalamus that can have an overall effect on your general health as well, that are going to have an ultimate impact on your fertility too. And finally, recurrent miscarriages. So there is a lot of information when we're talking about miscarriage, but recurrent miscarriages are defined as 3 or more losses. And that can feel really tough to go through 3 miscarriages before you can have investigations. Some areas do offer investigations after 2 miscarriages, but it really does depend on the area that you're living. And that's if you're in the UK. If you're in other countries, you might be able to go and have investigations sooner because your insurance may cover it, or it's private healthcare. Obviously, if you're paying for private healthcare in the UK, then you can have investigations sooner. But if you are having recurrent miscarriages, there could be a reason, and there's so many different reasons, and it can be due to, more often than not, it's due to chromosomal abnormalities, but you are looking at environmental factors as well within the uterus. So things like endometriosis, fibroids, anything that impacts the uterus, clotting disorders, autoimmune disorders. There are quite a few things that can cause recurrent or early miscarriages. So if you are in that situation, do push for referral so that you can get the diagnosis that you need.